Skill 2 of Nursing 234 talks about IV medication. The next medication we're going to talk about is the IV piggyback medication. Our patient, Mr. Smith, currently has normal saline and infusing at 15 mils an hour. And don't forget, this tubing is good for 96 hours. When we do intermittent tubing, they need to be changed every 24 hours. And at HRH, they do it at 9 p.m. This is our medication. We'll call it ANSA because I know how to find it in here nice and easily. And it comes with this little baggie. Oh, no, here's my little thing. And you need this little cute little hook. Because when you hang a secondary IV piggyback medication, the primary bag needs to be lower than the secondary. So we're going to lower this, just like this. And actually I'm going to raise this just a little bit. And after the secondary is done, you can leave this lower, your normal saline. We checked compatibility on the computer before we came in here with our ANSA, and we've identified that our normal saline is compatible with our ANSA. You're going to come over here. You're going to assess your IV site before you start any medication, and you're going to verify the patient's name and date of birth with the MAR and verify that they don't have any, if they have any allergies. Luckily, Mr. Smith doesn't. I'm going to scrub the hub of this port because when you give this medicine, you need to use the port above the IV pump, because if you use the port below, it'll be a giant bolus of medication. So you're going to pull your little cute little blue tab, and you're going to take this lid off, and this is sterile and this is sterile. There are different ways of priming tubing, but you're going to do it my way. You're going to close this clamp for a minute. And if you touch this on something, I don't know if I did or not, but I'm going to be extra safe because we don't want our patient to get septic. Just going to clean that with some alcohol. If it touched the floor, you'd want to get a new one. And we know this is sterile. So we're going to open this. I'm going to have to move my table. Hold on. So you can see. And as you open this fluid, as you open this little roller clamp, fluid from here is backing up into this thing. So you can see it in that little chamber. So I've made it all the way. Now I've clamped it as I flipped it over. And then you want your little chamber half full. And you're going to open your roller clamp. It's not going to go because I'm going to hit stop. And then you're going to come over here and you're going to hit program primary/secondary. And then, hold on. Okay, we're going to program our secondary. Ceftriaxone's the drug, CE. And I'm going to choose ceftriaxone. And it's 1 gram per 50 ml. I'll put some sample palms up there. These 50 mils need to go over in half an hour. So if we have 50 mils that need to go in half an hour, we need to take 50. We need to take 30 minutes times 2 to get 60 minutes. And we're going to take the 50 mils times 2 to get 100 mils an hour. And I'll put some sample doses that you can plug into here so you understand. The bags you practice with, these are little cute little 50 ml bags, but if I give a sample palm at 250, just pretend that it has 250. So our rate, it already calculated it for us, of 100 mils, volume to be infused is 50, and the rate time is 30. And I know that normal saline is compatible because I told you earlier we checked that. It says call back at the end of the secondary infusion. Go ahead and hit yes, because in 30 minutes this will beep at you when it's done, so you know your antibiotic is complete. Now I've opened this roller clamp, and because this is higher, the secondary is higher than the primary, this should not be dripping. So when I hit run, it says our drops falling in the secondary drip chamber and not in the primary. And as I look up here, I just saw 1 drip. I like to see 2. And there's 2, so go ahead and hit yes. And they may not fall if this is clamped. so they know it's clamped and it's running. So your key point of this is when I primed the tubing, I did it, some LPN students may question why I did that, but I didn't waste any of the antibiotic when I primed it, so the patient will receive all of the great antibiotic they want to receive. And that's how you initiate an IV piggyback medication. And then you take off your gloves and you want to assess the site and tell the patient if they feel anything different because it's an antibiotic. It might be their first time, to let you know right away. And then perform hand hygiene. If you have any questions, stop by and ask me questions. Thank you.